we grow food, and our kids will pick that and we'll cook it. And they've seen everything now, from literally a seed in the ground to actual fruit to something that they eat. And I guess the question was more about the fact that that's not happening enough and what do we do about it? And I'm touting the virtue of it happening, so I'm not sure I'm answering the question, but yeah, we do that, and I think it does bring them a great deal of joy and pleasure. They love that.
Yeah. I think that imitation food is not bad, but fake food may be better.
But it's you know, understand, one of the contributors, I mean, has been this mobile food. I mean, it's not just what's in the fast food, but the fact is you can eat the fast food any place, anytime, that it's mobile. That contributes also, that accessibility anytime. It certainly breaks down the barriers that tended to protect us from overeating.
Right. On this side?
Dana Park, Integrative Medicine, Asheville, North Carolina. Dr. Kessler, do you believe that we are now getting our emotional nourishment off a plate? That we are using food as a way to get good feelings, connection, relationship, and that we're literally eating it rather than connecting?
It's not our only source of, you know, that I think gives us that emotional resonance. But understand, I mean, the activation of the brain, we're dealing with the emotional core of the brain, and the automaticity that these stimuli bring. I mean, and you're sitting there, right? I mean, for those of, I mean, and some of you may have no idea what I'm talking about, right? But if you're sitting there at 11 o'clock at night and you're eating a bowl of ice cream or a bowl of cereal, you've had a hard day, and you have no idea what I'm talking about, right? I mean, understand what that's doing. When you're doing that, right? We don't have a good word in the English language, but you're almost in a trance. All the stimuli, all the stress, everything that you've been thinking about, right, sort of fades away because the emotional core of the brain is what's being stimulated while you're doing it. And that's what you're activating it. And none of the other stuff can get through. And afterwards, for a moment during that time, you have none of the other cognitive pressures on you. So that's how food does. You know, it really does. It's an anxiolytic. There is no question about it. And you know, millions of people. I mean, it's the cheapest one that we have available, and it's certainly, you know, I mean, up until recently, it's probably, you know, in some order, it's probably one of the safest.
At the same time, sharing good food together with friends, with family, with loved ones, making it together, eating it together, I think throughout history has been one of the strongest emotional bonds and personal bonds and sources of satisfaction. And you know, to see that restored in our culture would be great.
But we do use it at times of emotional transitions. Right? So if you're bored, I mean, if you're stressed, right? I mean, there is no doubt, I mean, if I'm running for that plane and I haven't eaten, I mean, and I'm tired and I'm fatigued, I mean, and I'm feeling, I mean, I'm going to grab something that I would never grab or want to grab, right? I mean, that is the reality. I mean, I think we are more vulnerable than we recognize. One of the things that I think is, you know, that I certainly, I mean, as I've learned more of the neuroscience, the more empathetic that I am to people who have a hard time controlling their eating. And I really do think when you sit there and explain to somebody who has a real hard time with their weight, and for the first time you say, look, you're being cued. That cue activates your brain. There's thoughts of wanting, there's this arousal, there's this activation, and they're sitting there, and they sort of intuitively knew this, but no one ever really explained it to them, I mean, how it worked. Now, just because your brain's being hijacked or being activated doesn't mean you don't have a responsibility to try to control that. But I mean, we haven't given people the tools, right? Because we've only begun to understand. The industry will say, well, we're just giving pleasure, we're just giving food, I mean, we're just giving calories.
Giving people what they want.
Right.
But you're saying it's not just, I mean, a bowl of oranges would not have done the same thing as a bowl of ice cream at 11 o'clock at night. You're saying it's not just food, it's the type of food.
I do not, I mean, I can overeat on ice cream. I have a hard time overeating on oranges. I mean, but I understand what we've done, right? I mean, just look at the difference in substance. I mean, an orange has a substrate, it has the fiber, it has all the things that slow down eating, right? And what is the food industry? I mean, you know, to their credit or to their blame, they've learned to take out anything objectionable that slows down eating. I mean, that's what processed food has done. So, I mean, I can just sit there and self-stimulate myself.
Now, David, I used to do that with ice cream, and I don't anymore. I've learned to be able to have ice cream sitting in my freezer and not eat it, or just eat a bite of it. I have not yet learned to do that with chips. If I open a bag of you know, good quality chips even, if I open a bag of good quality chips, I am going to finish them. Right. So my strategy there is I cannot have them in the house. I just don't have them around, and then it's not an issue. Now, I'd like to be able to learn to have them around and eat one or two, you know, as I did with ice cream. I did learn that. I haven't yet mastered it with chips.
You know all the secrets you're getting here?
Hi, I'm Abby Lane. I live here in Atlanta, and I'm actually an IT professional.
It's very hard to hear you. Can you speak closer to the mic?
Yes. Is that better?
Yes.
Yep.
Hi, I'm Abby Lane. I'm from Atlanta, and I work in the IT industry as well as the supplement industry. And my question has to do with technology and its impact on our eating habits. And what I wanted to speak to is when Dr. Kessler talked about 30 to 40 years ago, people who had different habits, they also, I think, worked different hours. I mean, they were working day shift, 9 to 5, whereas now you have people that work the night shift, graveyard shifts. They may be on call and get woken up in the middle of the night, and I think that also drives food. So what is your take on technology and its impact on the food and our eating habits?
You know, I think, at the core of your question, I mean, sleep, and I don't think we fully understand it. Right? But something as basic as sleep and cooling down, that nervous system. I certainly, if I'm on call, I mean, if my sleep cycle is disrupted, I mean, if I'm fatigued, I don't have the data on it, but I know I'm eating more. Right? I mean, in some ways, because my frontal executive control is just. There's a certain limit to how effective it is, and I could bring that to bear, but I can't keep that going 24/7. That kind of frontal executive control. So I think something as basic as sleep is important for wellness.
Well, I think it comes out of UC San Francisco, the work on HALT, hungry, angry, lonely, and tired, and if you can resolve those, then you don't...
Well, but that again, that HALT is typical, I mean, is vintage AA.
Right.
I mean, but that's the elements of a conditioned and driven behavior. I mean, any behavior that affects the emotional core of the brain is going to get amplified when you are stressed. Right? I mean, when you're hungry, I mean, any of those conditions. That tells you that the emotional core is being activated.
What about, though, when you're, there's an awful lot of mindless eating that goes on, eating in front of the television, where people aren't stressed, but they're certainly in some kind of trance, and it's possible to eat completely mindlessly, not even noticing much of what you're eating.
It's just priming. Mm-hmm. I mean, once you prime those neural circuits, I mean, it's almost, I mean, you almost feel like you have an electrode in your brain, and it's just constantly, giving I mean, you can do that, right?
Make people hungry. That's
you
right.
make people hungry during your program?
Yeah, possibly. But, along those same lines, though, eating more slowly, it takes a while for someone to feel satiated. So right? I mean, the stomach literally sending a signal to the brain.
I'm not sure I understand satiation. I mean, certainly I understand satiation extreme, when there's stretch receptors, right? But then it's too late. I mean, right? So the question is, what is satiation? I mean, when I'm eating, when I'm in that trance, when that emotional core is being activated, right? I don't feel any, I mean, there's no satiation. And people say, just eat when you're hungry. Well, I'm hungry all the time. Right? I mean, that's because when that emotional core is being activated.
I think we've learned that you might need a therapist for that.
Either that or a neurosurgeon. Right?
You should write a book about this.
So on the technology side, I would just add, as a technologist myself, that there are positive uses for technology as well. Whether it's, I have 718 calories left for today, I know this from my iPad, or really giving you more food labeling while you're shopping or in the store, or pointing you to what's in season. I think that there's the downside of tech, but there's also the upside of tech too. On this side.
Hi, Shaylin Harris, physician, Atlanta, Georgia, where McDonald's is a few steps outside of Grady Hospital, as Dr. Gupta knows. And actually, that was a nice segue into my question, is we talked about behavioral psychology, we talked about advertising and marketing. My interest, instead of looking at how we can restrict advertising, which may be one strategy, is an alternative strategy, which is looking at innovative ways to leverage technology by creating tribes or virtual communities that we can leverage things like social networking. And so my question is, are there efforts underway to leverage innovative means by which we can get out public health messages and create these movements?
Well, there's the hashtag, eat well. Use it. Make your social network happen.
We believe at CNN certainly that there is, and we've been doing all sorts of things within media and now extending into social media to address that very thing. Part of the difficulty is measurement of success. It's hard to always know what's working. Oftentimes the people that say that it's working are people who want to, they want to declare that they've gotten some benefit from whatever it is that you've done. So it's just one segment of the population. What it does for the overall health, the overall knowledge about health, it's a harder thing to measure. We believe that it works. I mean, we do all sorts of things. And our first grassroots sort of advocacy project that we ever took on as a media company really revolved around some of these same issues. Where we actually went around to campuses and events all over the country with people, at CNN to really recruit some of the best ideas to address some of these problems and to help execute those solutions in various communities as well. But it's hard to measure success a little bit, which I don't think should be a hindrance, but it's just the reality of it.
Social norms have a very important effect on our individual behavior. I still don't know which is the more powerful, whether it's the negative or the positive. They both have in effect. But the kind of support networks and what our social norms are, I think that's where. Again, not to say they're the same, but if you look at the public health success on tobacco, changing the social norms was what made the difference, right? And the question is, I still think changing social norms when it comes to food, whether it's the positive or the negative, is going to be a very major, otherwise we're toast, as a country.
You have an option with food. With tobacco, there wasn't something to emphasize that was positive. This idea that you do emphasize the healthier foods and that becomes the social norm.
And that's what I want.
Right. That seems like a desirable alternative. And I think we have precedent not only here in this country, as you alluded to earlier, but around the world.
And
they have ice cream in France. Right. They don't eat as much of it.
They also have French
absolutely.
fries.
But it's going to have to, the positive has to have the same kind of emotional resonance. Right? As the emotional resonance of eating that whole pint of ice cream, as disgusting as that may may seem.
Well, we haven't seen the celebration of food quite the same way for real food, whole food, good food.
I mean, and that's when, you know, and I do think, again, you know, you look at Alice Waters, you look at others, that celebration, as you were mentioning, if you can have that kind of emotional resonance, if it can become meaningful to you. And that's why I think whether it is, you know, you want to eat whole foods, you want to eat organic, you have, I mean, whether the ethical issues with animals, the more we can attach some emotional resonance to it so it becomes meaningful for people, I mean, that I think has to be part of this, because just information, neutral information alone is not going to change behavior.
You want to make it fashionable and cool to eat healthy food, and unfashionable to eat fake food.
Right.
Just as that's the goal.
I mean, that's exactly, and that has to be what the social norms are. And the food industry has learned how to make the other stuff fashionable, yes, exactly, and cool. Yeah. And that's the real effort. And I do have to give her credit. I think, you know, the First Lady, I mean, is trying. I mean, you know, the kind of education and the kind of legitimate role the government has on education, I think she's trying to do that.
But, you know, if these companies could make the type of money that they make on healthy food that they make on unhealthy food, I think a lot of those things will follow. I mean, all the advertising campaigns that you're talking about, that type of food makes you happy, all the sexiness surrounding a lot of these unhealthy foods.
But that's the emotion, you know, sure, it's reinforcing, sure, but that happiness is the emotional gloss that's being added to it.
Okay, guys, we're going to go into the lightning round because we've got about 8 minutes left and we've got about 8 questions left. So if you guys can keep your questions really short, I'll try to get you all done while we have to close on time. Over here.
Yes, Dr. Weil, Wendy Bader, Phoenix, Arizona. Your comment about saturated fat in the new study has been haunting me ever since yesterday morning when you first mentioned it. Was it one study, and can you give me the source of the study?
It was a very large meta-analysis of many studies. It's a very good piece of research. It's very convincing. I'm sorry I don't have the reference in my head to give you, but I'll try to get it by tomorrow morning for the conference.
And he'll post it on Twitter.
And, you know, a cardiologist friend of mine who was chief of medicine at the University of Arizona, when I told him about it, laughed, and I sent him the study, and he said, wow. And he said, well, I guess that means you can have a steak once in a while. I choose to have cheese instead.
And most importantly, as far as you had mentioned for years now that doctors are not being trained in nutrition properly, what can we do as a room full of medical professionals and 3 very influential men up there to change that?
Well, I think we're trying to change it through the Arizona Center for Integrative Medicine. We have established nutrition courses. These are available online to all health professionals, to medical students. Familiarize yourself with them, tell people about them. Eventually, this will become a required part of the curriculum.
This way.
Hi, Laurel Hardwire, doctoral student in epidemiology at UNC. I was wondering, you commented a lot on community changes and what should be done, change social norms. Could you comment on what could be done at an individual level for low-income individuals who are either in food deserts or working 2 jobs, not having time to cook or prepare meals, and it's faster to pick up fast food?
You know, in many cases, first of all, the most expensive elements in the diet, it's often meat and animal foods, and there are many vegetarian dishes that are easy to prepare, that are cheap. There are many ethnic foods that are great in many of the minority cultures in the U.S. that should be emphasized as being healthy, and I think we should also politically be working to get subsidies for fruits and vegetables and to end the subsidies to soy and corn. That's a very high priority. The fact is that fruits and vegetables are out of reach economically of most poor people in this country.
And Rick mentioned last year slow cookers.
You're right.
Right.
Okay. Say something about that.
Last year, Rick Bayless's strongest recommendation was to get a slow cooker, to get beans, rice, and other one-pot meals going for 3 days at a time, and keeping families eating well. He was I went home and bought one. So. Here you go.
Jennifer Cully. I'm an internist and on the faculty at Emory, and that really ties into what I was going to ask similar. I work with the underserved population, and I find that Dr. Weil already alluded to this, but that how do you meet them halfway before making radical changes? What are the specific advice we can give now to kind of bring them toward us and move towards a healthier lifestyle and healthier eating?
You know, I often say if I could summarize everything I know about nutrition and health as a result of helping organize these conferences for the past 7 years, it's stop eating refined, processed, and manufactured food, or to cut way down on that. That is it in a nutshell. You know, that's what's making people unhealthy in our culture.
Over here.
John Wenger. I'm a family physician from Virginia. Every day I see lots of patients who are in tremendous need of education and guidance, of better nutrition, improved nutrition, and lifestyle, as many are in this room, doing that. My question is, my specialty colleagues, government, the community wants us to do that, needs us to be a voice for that. From your unique vantage points, do you see any voice out there to guide the system, change the system so that that is reimbursable to us, that supports the primary care people who are trying to be the educators, be the teachers? Is there a voice anywhere in this complex sea of debate to help bring that change?
David Kessler.
Thank you.
Okay.
I teed that up.
Hi, my name is Robert Karch. I'm a pediatrician in Philadelphia. I haven't heard any mention of the importance of breastfeeding, and breast milk is the most important food that we give our infants. I'm wondering what we can do to better promote breastfeeding in this country.
Couldn't agree with you more. One of the things that I've tried to do personally is that Weil Lifestyle, from which, by the way, I receive no profits. My profits go to a foundation which supports integrative medicine. But there's a product line of Weil baby products, which are made of BPA-free plastic. These are the first perfectly, I think, safe plastic bottles for storing breast milk. And we're about to come out with a revolutionary new breast pump in a couple of months that's equal to the quality of breast pumps that women get in hospitals. And this is a comfortable breast pump. I think it makes, so I'm doing everything I can to promote breastfeeding and make it easier for women. It is indeed the best food that we can give, and the longer that we can give it to babies, the better.
That's super real food.
One of the great initiatives on the world stage is the Baby-Friendly Hospital Initiative.
Yep.
It hasn't been well implemented in this country. Only 80 or 90 hospitals in this country are baby-friendly. One of the reasons for that is step number 6, which prohibits the donation of formula to hospitals. So I'm wondering how we can end that practice of free donation of...
Well, I think it's all a matter of education and information. It may well be that the longer an infant is breastfed, the more they'll be resistant to these brain-activating mechanisms of some of this food. It's possible.
Hi, I'm Lauren Zimmett. I'm a speech pathologist here in Atlanta, Georgia. And first, I just wanted to thank you for this public forum because it's phenomenal and very validating. And I just felt the need to share. I'm working with children now, and I'm teaching them about brain health and the basics of nutrition. And our children are sponges. They want this information. It's amazing to see how children are so open and receptive to tasting healthy fruits and vegetables. And it's possible, and I hope that if everybody in this room really did something in our own communities, in our school systems, we really can make a difference. I'm involved with, there's a farm to school program in many states, and that I think is a stepping stone for getting healthy fruits and vegetables to our children. So thank you.
We'll know we're on the right path, when that 6-year-old says to their mother or father, please don't take me to that fast food restaurant.
All right, that which gets measured gets done. We'll start measuring it.
Hey, I'm Elizabeth, and I'm a registered dietitian here in Atlanta, and also the mother of a 7-year-old daughter and an 11-year-old son. And I'm going to start wellness program within our Atlanta City school system in North Buckhead, along with a buddy of mine. And clearly, the whole idea that you all have continued to hammer is the awareness of the importance of exercise, awareness of why you eat, awareness of what you eat, and how important that is. In reference to having a wellness program in the elementary school, and then also in the junior high, I'm going to be at Sarah Smith and Sutton. Is there a topic matter that you would begin with in an elementary program? Would it be different than one that you would begin with in a middle school program? And this is to any of you wonderful people up there.
There are curriculum that are being developed, fifth grade curriculum, other curriculum that involve life skills, and people have spent a lot of time thinking about how do we really bring this back into the educational system. So yes, I mean, I think that doing that and encouraging what you're doing, I mean, is just so important.
Well, we're at the end of the program. We've covered an enormous amount of territory. I think we have some consensus. So I'm going to ask each of you, starting with David, one thing you think the crowd should take away that you think is important for them to take out into the world and sort of share with their friends, families, and others.
I think there's an enormous opportunity over the next 20 years. A lot's at stake. I mean, I think it's going to change how we look at food. It's as basic as that.
I think food is one of the root causes of a lot of the diseases that we talked about initially in this discussion. And I think that the real goal ultimately should be to try and create a society where we value healthy food and have it as accessible and as affordable as some of the foods to which we become so accustomed.
And I would just say, make yourselves very clear about the differences between real food, true food, and fake food, and educate other people about that. Your children, your friends, just increase awareness in our culture about that difference.
Well, please join me in applauding our panelists. Thank you all for coming, and have a great evening.